Hi, I'm Lou Scott, and this is the Geppetto Room, where you don't have to be creative to be creative, you just have to be you. Because here we're going to explain techniques and methodologies that are going to help you make transformative decisions, easier decisions, about how you work, how you play, and how you live in the state of Vermont. Now today, we're not going to go over any kind of methodology. We're interviewing two unusual guests who are now involved in what I think is a transformative initiative, and we're going to hear about that initiative. The two guests are Kevin Loso, who is the executive director of the Rutland Housing Authority, and Tracy Moore, who's the director of development and community relationship at the Rutland Regional Medical Center. Now together, with other agencies in the city, they're doing what I've been calling Housing is Healthcare, an initiative. Now, it has a more official name, but I thought the housing and healthcare is an interesting transformative phrase by itself. And what they're trying to do, we're going to be hearing about how they're going to be doing, because when you think about shelter as a shelter, it is healthcare. But when you think about the homeless, it's more than that. It's the homeless shelter housing is relevant, is indicative of something that has to be done otherwise for their health. It has to be. So with that, I'm going to turn it over to Kevin Loso, and we're going to hear from him first. Kevin, how are you?
I'm well. I'm very well, Lou. Thanks for inviting me today. I have to start by thanking you and, of course, the entire staff of PEG TV for somehow managing to continue to develop quality programming during a pandemic.
Thank you very much. And the Geppetto Room is now yours. We want to hear about this health care, that housing is health care. It's fascinating.
Yeah, thank you, Lou. The Rutland Housing Authority, in partnership with a number of organizations in the community, is developing a 9-unit property up on Woodstock Avenue. It's 101 US Route 4 East. It's the old Hendy Brothers commercial space. We are, as I said, doing this in partnership with a number of organizations, and it's really designed to assist in getting people out of motels. There are currently about 150 or so homeless individuals and families in Rutland County living in motels.
Wow, that many?
Yes, either they were homeless either prior to, or many are homeless as a direct result of the pandemic. A lot of congregate housing sites had to.
I mean, there's additional homeless because of COVID?
Oh, absolutely, absolutely. There was an eviction moratorium. There was a foreclosure moratorium. But even at that, there have been families who have significantly lost income as a result of COVID, and some of those families have ended up in motels through the state's emergency motel voucher program. So our goal is to transition these families into what we hope will be temporary housing. The goal will be to get those families stabilized and then move them into permanently affordable housing. So we're working
so what you're putting together as an initiative would be for temporary situation until they get to other kind of housing?
That's correct. The goal is to utilize this property as emergency housing, transitional housing, shelter housing. I mean, we're not really trying to put a title on it. The goal is to get families in, to assist them in stabilizing, and then to locate permanently affordable housing for them so that they can leave the bridge housing property and frankly make space for the next family. So we have quite a team of agencies throughout Rutland that are working with us on this exciting project. The Homeless Prevention Center will be assisting us in identifying families and then getting them through the application process and ultimately into the building. Rutland Mental Health Services will have a case manager on site providing services to families who are understandably under an enormous amount of stress, anxiety, depression, as a result of what they've been going through.
And the Housing Authority is coordinating all these groups, all these agencies? That's a big job.
That's correct. We actually, the Housing Authority is the developer, owner, manager, and coordinator of services for the site. So in addition to the Homeless Prevention Center and mental health, we're also working with Brock Community Action, our friend Tom Donahue, because our goal is to not just secure permanent housing, but also to assist people in moving towards family self-sufficiency. So as you probably know, Brock has an extraordinary array of programs that are designed to assist families in
So not only
moving.
is this housing temporary, or these people coming in there, but you're going to offer other services to them. Not only give them shelter for their health, you're going to give them other services to get them back into the community
Absolutely.
by all these other
Absolutely.
groups and so forth?
Absolutely.
And you're coordinating all that.
We are, but with a lot of help. Another very exciting component to the project is that the hospital, Rutland Regional Medical Center, has worked with us to essentially reserve 2 units specifically for people who are stuck in the hospital because obviously it would be unethical to discharge a patient into homelessness. So they'll have 2 units in which to move people from the hospital. They'll be providing, again, on-site services depending on the needs of the individual or the family, and they will coordinate with the other services that will be
So
available.
2 units will be dedicated to people coming out of the hospital.
Absolutely.
How big are these units? How big is, for example, how big would that unit be?
Well, we would have 2 one-bedroom units, but we would also need to be a little flexible in terms of people being discharged who might have children, for example. So we'll be flexible there, but the intent is to have 2 units specifically for Rutland Regional Medical Center, and they'll be providing support in order to maintain those units and to assist with operations. The other thing that Tracy will be talking about later is the extraordinary effort on the part of the hospital to raise funds to get the facility established.
I'm hoping that I get involved with Tracy in terms of the actual impact. I was impressed with the impact that shelter has on patients' health. I mean, it influences all disease states and so forth. I mean, shelter for safety, but the idea that it impacts health in such a direct way was fascinating to me. People don't know that.
Well, I think we've known it intuitively for a very long time, but it wasn't until the last decade, at least nationally, that that link was firmly established. Clearly, the data shows that homeless individuals experience higher rates of uncontrolled blood pressure, cholesterol, asthma,
diabetes. You name the disease
Exactly.
states. It's amazing. Healthcare, housing is actually healthcare. Yeah.
I think it speaks volumes that during the recent Rutland County Health Assessment process, which is coordinated by Rutland Regional Medical Center, housing was one of the top 3 needs identified in this community as sort of where we should be channeling our energies and resources.
Now, is this being built now, or should be?
It is being built now. It is quite extraordinary.
Yeah.
It's being funded through the Federal CARES Act, which in turn has will flow through the states. Vermont has taken a very innovative approach in that they are using part of those funds. I think it's $1.something billion coming into Vermont. They're using part of those funds to develop housing opportunities for people who are homeless. So that grant is being administered by the Vermont Housing Conservation Board, a long time supporter of affordable housing development. Indeed, that's their mission. They've helped us with other projects. And we were awarded part of the $35 million to construct the bridge housing site up on Woodstock
When
Avenue.
is the occupancy going to begin? When is it supposed to be completed? What's the schedule?
Well, that's an excellent question, Lou, because as you may know, the CARES Act funding has some very strict deadlines, such that if hopefully it'll loosen up, but the states are required to expend most of those funds by December 31st, 2020.
This year?
This year, 2020.
When do they expect the building to be completed? By this year, in a few months?
This year, we will complete the building by December 20th of this year, and we were able to do that again. This project is blessed. Caprice Hoover from United Way identified the need early on. Indeed, she's been working on emergency transitional housing for a long time. And then when these funds became available, or there was, it was understood that they may become available, she hit the ground running and did a lot of legwork for us. And then when it became clear that there was a real opportunity, the Rutland Housing Authority stepped forward and said, okay, we'll develop and own and manage and whatnot. Okay. So December 20th is a very tight deadline. We started, because of some unexpected permitting issues, about 20 days behind. And our general contractor, who I have to give a shout out to, Naylor and Breen, is now, things are moving so quickly that we can't decide whether or not they're 3 days ahead or 7 days ahead of schedule. But they have made a commitment, along with their subcontractors, to get that building done.
If you had to say some final words in the last minute or so, what would you say about the whole effort? I know you've been very complimentary about the groups that have been helping you and the cause, but what would you say? What do you want everybody to know about?
Well, I would say that although 9 units is significant, it barely scratches the surface in terms of the need for affordable housing in the Rutland community. And I will go back to saying that, although the Rutland Housing Authority is sort of taking the lead without
taken
all
a hell of a lead.
Well,
tremendous what you've been doing.
Well, thank you. Although we've taken the lead, we could not do it without Rutland Regional Medical Center, the Homeless Prevention Center, Rutland Mental Health, Brock Community Action, and the countless number of individuals and organizations who stepped forward to say, yes, this needs to happen. How can we help you?
And the coordination of it, you leading it, I think, lends real credibility of your own talent in the Housing Authority all these years. I really think so. To get that many groups coordinating takes a hell of an effort.
Well, thank you. It's sort of the culmination of my professional experience in that I started in fundraising, I moved to healthcare, I then moved to housing, and all the skills that I've been very fortunate to develop over the years are all rising up with one big project. So it's a pleasure. Thanks
very much. It's been very informative. I appreciate it.
Lou, thank you again, and thanks for your great work.
To continue our talk about housing is healthcare, which is my title, which I think is very provocative and very transformative. Okay, we're going to be talking to Tracy Moore. Now, Tracy Moore, as I said, is the Director of Development and Community Relations for Rutland Regional Medical Center. But before we actually talk with her, we're going to see a short film. Stand by.
The community has lacked a formal transitional housing option for many, many years. Some would call it a shelter, some would call it transitional housing, but I think the bottom line is that with the addition of the Woodstock Avenue Bridge Housing Project, we'll have a significantly greater level of flexibility to meet the needs of families who are transitioning out of homelessness.
I work as a peer advocate counselor at VCIL. I've been working there for almost 8 years, and I work with peers who have a wide variety of disabilities. Sadly, we have a lot of homeless people that we work with, and finding them housing sometimes is a challenge.
Housing was one of the top 4 community health needs that we identified in our community health needs assessment we conducted a couple of years ago. And housing is critical to people's health and well-being.
Managing a chronic illness is a challenging thing, and engaging patients in the management of their own chronic illness is really important. Very hard to do that if there's not a stable home environment to work out of. And patients who have that to look forward to from when leaving the hospital are much more engaged in managing their own illness.
It's one thing to get people into housing, it's another thing to provide them with the supports to ensure success.
A lot of what's going on in healthcare and a lot of things that are contributing to the cost of healthcare have to do with not your medical situation or your genetic background, but due to social determinants of health, of which adequate housing is one of those. So for example, in Vermont, in the wintertime, a lot of times we see people show up at the emergency department not because of medical needs, just because they need to get in and out of the cold.
In the emergency department, we struggle many times to get patients who don't have emergency medical needs or emergency surgical needs, for example, to a safe place. And so that means in many cases they have to remain in the emergency department, which is a very busy and chaotic environment. And having the ability to get folks to a safe, secure, and reliable environment really begins the healing process in ways that are delayed otherwise.
It's hard to be healthy if you're just trying to find a place to sleep or to live. You know, how are you going to get food for yourself or even afford food if you're just trying to survive on the street?
So the truly exciting aspect of this project has been the willingness of so many organizations to come together to make it a success. Without that support, we clearly would not be where we are.
I've seen very few communities in my lifetime where people really rally around each other. Whenever there's a cause, whenever there is someone in need, you see people in Rutland really come together.
I would say it's very important to support the Housing for Health campaign because it would help a lot of people get out of homelessness and into safe, affordable, accessible housing and improve a lot of lives.
And your dollars will go to an immediate project that's already been approved and is being developed that will be up and running by the end of 2020.
We are extraordinarily grateful for anyone who is willing to support the campaign at any level, because it's a community effort and it's going to take a lot of people in order to achieve the goal. So I can tell you with certainty that it'll be a good investment in the community, and the Rutland Housing Authority, along with our project partners, will make you proud.
On behalf of Rutland Regional Medical Center, the Rutland Housing Authority, and all of our community partners that are participating, a sincere thank you. Without your help and support, this important community project might not be possible. Thank you very much.
Hi, Lou Scott again. To continue our discussion about housing is healthcare, we have Tracy Moore. As I said before, Tracy Moore is the Senior Director of Development and Community Relations for the Rutland Regional Medical Center. Welcome, Tracy.
Thank you, Lou.
The Geppetto Room is yours.
Well, thank you, Lou. I am really pleased to have the opportunity to be here with you today and with viewers from the community to talk a little bit about the Housing for Health campaign that Rutland Regional Medical Center is currently working on in partnership with the Rutland Housing Authority. This is a campaign to help establish safe, secure housing in our community.
Now, this is funding for the housing, which I've been calling, housing is healthcare. This is funding to continue that program that the hospital is doing.
Yes, so
Okay.
the hospital in early October launched this campaign, Housing for Health, in conjunction with the Rutland Housing Authority, again, to establish safe, secure, and supportive transitional housing in our community. The particular project that the hospital is hoping to raise funds for is a project at 101 Woodstock Avenue, which will establish 9 units, transitional or bridge housing units for folks in our community. And actually, Rutland Regional Medical Center will occupy 2 of the 9 units. So
2.
we will always have those 2 units available
Dedicated
to the hospital. Certainly, I think if there are units that are not in use and the hospital has more than 2 opportunities to house folks, that
That's
can
certainly
be done.
better health care when you think about the idea that you can't really have someone leave the hospital to be homeless. You really can't. So they hang out in the hospital, which is, during these times, is not a very good idea. So that's interesting.
Yeah, it really has, I think COVID has really enhanced the need for appropriate housing for people in our community. To your point, it's harder to bring people together in unseparated situations for fear of risk of spreading COVID-19. So the Rutland Housing Authority had this unique opportunity to address what has been a very long-term need in our community, the need for housing. So the hospital this year had really paused a lot of our fundraising, Lou, with the onset of COVID-19. And early on in the spring, we had taken the opportunity to do a little bit of fundraising in support of food insecurity in the community, knowing that with COVID, there may be more people in the community who were struggling financially or had some challenges that they may not have had before due to a loss of a job or illness. So we had worked during the spring months to raise some money in support of our local nonprofit food shelves and those organizations that are supporting people in the community financially.
So the reality is that COVID actually is causing even more homelessness or financial burden than it was even before. And we had a considerable amount of homelessness in around the area.
That's really been, part of the expectation. So the hospital's efforts this spring were really to help organizations in the community address food insecurity. And then over the summer, in partnership with the Rutland Housing Authority, and understanding that there would be some Corona relief funds that came to our community to help support some additional housing units, the hospital organized a fundraising effort. Our goal is to raise $150,000 to support upfront capital costs associated with the project at 101 Woodstock Avenue, again, to help provide these new nine new units in our community.
Mm-hmm. So that's the goal, $150,000.
$150,000 is the goal. The challenge, Lou, really comes with the fact that we have a very short turnaround time in our ability to raise the funds. So as I mentioned, we launched the campaign in early October. We really have through mid-November to raise this money.
Kevin talked about, I was amazed that he has to spend the money. He has to be built by the end of the year. I mean, it was like, how could you do that? And they're doing it.
Yes.
They're doing it. That's an amazing thing. And the coordination of all the organizations that are doing it, including the hospital. It's impressive.
It's been very impressive, not surprising at all to me for this Rutland community.
Yeah.
So many organizations have stepped up to help make this project a possibility. Of course, the Rutland Housing Authority under Kevin Loso's leadership has been wonderful, and they've been able to move the project forward with the support of other organizations and in collaboration with the hospital on this fundraising side.
I'm going to give credit. I didn't give credit the first time, but I'm going to give credit to Rotary because we're talking about 4 Rotary. You're a Rotary member, I'm a Rotary member, Kevin's a Rotary member, and Caprice Holver is a Rotary member. So we probably have even more. So the organization is really doing the idea of service above self. It's impressive.
Well, again, something that I say often. People who know me know that I think this community is outstanding. We have a number of people who continue to volunteer their time and their resources to support whatever the need might be. We're very, very fortunate.
Even in COVID, where you're talking about volunteering now, it could be a dangerous situation.
It could be.
Yeah.
It could be.
Yeah.
Volunteering and most anything that we do looks different right now due to COVID.
One of the benefits of the campaign is when you have that direct relationship on person's health because they lack housing security, that actually when you supply housing security to those people like that, and you take the emphasis off their health care because now the health care is better, their health is better, you're actually going to save the community money. You're going to save because they're going to be less sick. They're going to be less disease states and so forth because they have safe housing. That's a benefit of this whole thing.
It really is one of the expected benefits of this project. The ability to discharge patients to a safe, secure location will hopefully help in their overall health care and hopefully lessen the chances of a reoccurring illness.
Coming back to the hospital, like that, which
back.
increases costs and so forth. So that's one of the indirect kind of,
It is.
The idea that people will be healthier.
Yes.
Yeah, housing is healthier. That's interesting. Tell me more about the campaign. How's it going?
Sure. So the campaign is going well. Again, we have a wonderful group of volunteers that are helping us to raise these funds in the community. Kevin and I are really excited to be playing a large role in the campaign, and it's great to have the opportunity to work closely with Kevin and his team. I think the biggest challenge with the campaign, Lou, is the amount of time. It's a much quicker turnaround than we typically provide ourselves when we're out in the community raising funds.
So that would be your final word, the idea of time. So send your money. That's what you're really saying. Huh? Really collecting.
So yes, I think that this campaign is unique in so many ways with the partnerships involved and the short amount of time that we have to raise these funds. We are so grateful for the continued support of our Rutland County community, stepping up to help with this housing campaign and really meet some of the challenge that's been in our community for quite some time.
Yeah. Tracy, thank you very much for that thing, and hopefully maybe we'll see you again. Come back again and tell us what's going on. I'd like to make some final words on the Geppetto Room. You know, we're facing life today is a new normal. If it's anything normal, it's not anything but normal. And there's a lot of anxiety. And I wanted to leave you with some kind of transformative thinking. It's really not transformative in the sense, but if we start to do more of these things I'm going to say, maybe we'll make it easier for us to get through this together. And here's some of the things. Be polite. Sounds interesting, but be polite. You have to express gratitude more than we ever did. People are people are serving us and so forth. Together, let's be more polite and expect gratitude more so than we did before. It's transformative. Forgive. We're in a time when there's a lot of opinions and going around political and so forth. We have to forgive each other if we're going to work together. It's very important, and that could be transformative. Okay. If you can, be generous. Be generous. And then that doesn't mean necessarily just with money. Be generous with your time. Be generous with your advice. If we start to be team together, if a community teams together, then we'll get through this with less anxiety and more success in the future. And let's have more acts of kindness. Okay, now these are not transformative things, they're human things, but in times like this, we have a tendency to forget them. Let's not forget them as a Geppetto Room. So this is the Geppetto Room. I'm Lou Scott, where you don't have to be creative to be creative. You just have to be you. Until next time, thanks.